There is concern while we're talking about vaccination. There is concern over growing vaccine hesitancy in the country. At one point, around 200,000 doses were being administered per day, but that number has dwindled significantly. eNCA's Monique Mortlock is visiting vaccine sites in Cape Town and to find out what is being done about changing that picture. Monique, I'm wondering if you're still at the Athlone Stadium. You were citing figures a bit earlier on of the people that have come through to be vaccinated. This is all part of the push by the provincial authorities to try and drive vaccination and especially do it in communities where people are, instead of having people commute for them to get vaccinated. What's the picture at this hour?
Yes, exactly. Earlier we were in Athlone, at the Athlone Stadium, and today's the first day of that stadium or that vaccine site being operational. When we were there, people were steadily making their way in. That site, just like the one we are at now at the CTICC, is a mega site, and the Athlone Stadium site can accommodate or can have up to 4,000 people getting their jabs in one day, and that is obviously the hope of officials. They're hoping especially when that 18 to 34-year-old cohort starts getting their registrations and starts being part of the vaccine rollout, that they will see an increase in the number. And Western Cape government, as well as the city of Cape Town, calling on national government to push forward that date so that they can have those 18 to 34-year-olds coming into the sites, but also bringing maybe family members who have been hesitant, especially those older family members. Here at the CTICC, where I am right now, another mega site in Cape Town, one that's in the heart of the CBD, where people who might be on their lunch breaks, those who are at work hoping to quickly pop out and get their jab. This site is specifically designed for those people, whereas the Athlone Stadium site is mainly for those living in the Athlone, Mitchells Plain, Khayelitsha area, where the numbers of the vaccine registrations are worryingly low. And here at the CTICC, I'm going to ask my colleague Monique January just to show you what it's looking like behind me. Quite quiet, empty, although we are seeing a steady stream of people coming in, getting registered. That's something that Dr. Sadi Karim from the Western Cape Health Department mentioned or emphasized a little earlier, that for people who might be worried that they haven't yet registered on the EVDS system, they can do so at the venue. So it's just simply a matter of bringing the necessary documentation, their ID, getting registered here. The process is a quick, easy one. As you can see, here's plenty of space. A site like this one also targeting 4,000 people a day. On a good day, I've heard from the site manager, Sister Letitia Saville, that they've been able to administer up to 1,800 doses. Obviously, they're hoping to get even more, as I mentioned, once that 18 to 34-year-old cohort is able to register.
I kid you not, Monique, when you were showing us those visuals with Monique January there a few moments ago, my jaw literally dropped. I mean, I had my mouth wide open. I just can't believe how empty it is. And this contrasts sharply with what the scenes we were seeing a few weeks ago. I mean, when I went to vaccinate in Parkhurst here in Johannesburg, I had to wait in a queue of about 5 hours. That's how much momentum was there at that point. But those scenes, unbelievable.
And this is something that Western Cape health officials are also concerned about, and that's why they're saying that the opening of mega sites like the Athlone Stadium one, they're hoping that it will encourage more people, especially those who are part of the uninsured population, those over 50s, over 60s, who are most at risk of contracting severe COVID-19 and ending up in hospitals should they not have the vaccines. They are hoping that it will encourage them because it's so close to these vulnerable communities. And a little earlier this morning, we were in Mitchells Plain, which is the area here in the Western Cape with the lowest number of vaccine registrations at only 26% of the eligible population being registered for the vaccine. And there we saw how community leaders were struggling to go out in the streets, encourage people, get them to come to the pop-up vaccine site that had been set up, which is something that Western Cape Health is also trying, as well as City of Cape Town, going into these areas to make it easy for residents, especially those who don't have transport, who might say, but I don't have money for a taxi to get to a site, to actually go there, bring the vaccine services to their doorstep. And even though this was happening, there were many sisters there trying to encourage the people to come, trying to give them the correct information about vaccines. People were still hesitant simply because of stories they've heard. And as one community leader, Joni Fredericks, told us, everyone standing on the corner shop is suddenly an expert, even though they can't really say where they are getting their information from. So it's really a dedicated focus now on tackling vaccine hesitancy, tackling misinformation, especially those that get spread on various social media platforms.
Right, I've got to thank you for that. But you can always count on me to be cheesy, Monique, right? Monique Mortlock with Monique January. And somehow they seem to always work together.